Kansas Heart documentation tips. At Kansas Heart, the cardiologist or surgeon is also the attending. This video has some documentation tips you may not encounter at other facilities where you are working as a consult and not an attending. Please don't ignore this important safety warning if it pops up when you go to do the admission medrec. It is essential to patient safety that you do not start the medrec until the nurse has ensured the accuracy of the home medications. This safety warning appears only if the bedside nurse has not clicked verify for the patient's home meds. Communicate with the bedside nurse to confirm that the home medications in the patient profile are accurate before beginning the admission medrec. The history and physical. I've included the timeliness requirements taken directly from Kansas Heart's history and physical policy, and you can pause to read it if you'd like. But the short version is that while the H&P may be drafted before admission, it must be updated and signed after the patient is admitted and prior to any procedure. Our H&P policy meets the minimum federal regulation requirements. If you want to look at the federal regulations I refer to, the link is here at the bottom of this slide. Copying and pasting. When information is reused from a prior note, the provider is responsible for its content. Avoid cloning, which is copying from a prior note and placing it into the current record without reviewing and updating it. Any time that you copy and paste from a prior note, you must edit or update it to reflect the patient's current information. Copying and pasting an office H&P without judiciously updating has implications for billing. It suggests to later reviewers of the document that the note written does not describe accurately the care that was provided on that date. When importing data into your notes, it's important to look at the date and time of your auto-populated data and assess if they are current. For example, sometimes the most recent set of imported vital signs are pulled over regardless of which visit you are on. On the right here is an example of a cardiology progress note with the date of service of February 22nd, while the vital signs are from November 30th. When this happens, you have two options. You can communicate with the bedside nurse and wait until they have imported the current vitals, then go to the three little dots in the right-hand corner of that vital sign section to click refresh. Or you can hide the vital sign section in its entirety by selecting the eyeball, and you can put a statement elsewhere in your note to see nurse's flow sheet for current vital signs. Electronic prescriptions decrease medication errors and adverse drug events and reduces wait times for the patient. It also increases the accuracy and completeness of the patient's records. But if for whatever reason transmitting a prescription electronically is not an option, then printing the prescriptions is far preferable to handwriting them, as it will still help to increase the accuracy of the patient's medical records. If you have any questions about this video or need any other assistance with your documentation, here's a list of contacts who can help you. At the bottom there is the 24/7 KHH IT Help Desk number. This concludes Kansas Heart documentation tips.